Good afternoon. My name is Paula Davis Smith, and welcome to the Strategic Planning for Building Cohesion in the Progressive Care Unit where I currently work. This presentation was developed over the course of a few weeks and it will explain the focus of building cohesion over the next few years. We will look at team building and setting goals. In order to achieve its vision, mission, and goals, members must work effectively as a team. Members should strive to understand and appreciate and communicate with each other. We must also understand that members are individuals and, as such, bring different values, beliefs, agendas, and experiences to the workplace. A key challenge for us as a team is to make effective use of diversity. All members share the responsibility for building cohesiveness and effectiveness as a team. What is the problem that's facing our team? The problem facing our team is the inability to build and maintain cohesion. How do we solve this problem? Clearly, if we are going to solve this problem that's facing our unit, we need to learn how to collaborate more effectively. We need to know how to set aside individual agendas so that a common understanding of a problem as an opportunity to develop. We need to know how the activities of people can be coordinated and their efforts brought together within a structure that integrates and focuses rather than diffuse. What are some characteristics of a good team, we may ask? Some characteristics are high degree of mutual trust, mutual support characterized by a genuine concern for each other, communications are open and honest, missions and objectives are clearly understood by all members, conflicts are confronted and worked through, the working environment is characterized by supportive respect for individual differences. Why build a cohesive team? Cohesion in the working environment is a necessary ingredient for binding people together, especially in diverse groups. It allows employees to stay together, especially during stressful moments, by creating a sense of shared responsibility among the team. Cohesion in the diverse team creates a positive perception by building team spirit, provide fairness in opportunities, training, promotion, and evaluation among the minority and majority group. Overall, it provides a positive working environment, increases employee satisfaction and retention rate. It also provides a sense of inner peace for employees to show up and be ready to tackle activities of their working day. Why do we need a strategic plan? Strategic planning gives us the direction in which we should go. It is usually considered as the roadmap that guides the company in the right direction. It sets priorities. It focuses its energy and resources. It strengthens operations, ensure that employees and other stakeholders are working toward common goals. It establishes agreement around intended outcomes and results. It also assesses and adjusts the organization's direction in response to a changing environment. PCU team building goals. Our progressive care unit is known for its diverse groups, diversity in skills, knowledge levels, ethnicity, and rich culture, yet it lacks cohesion. So, what are some of the objectives of the group? Our objective is to bind the group so that they get to know each other and begin having a sense of team. To establish a positive team culture, the beliefs, values, and norms of behavior. To nurture shared problem solving and generating new ideas. To introduce processes so that they work effectively together. Example, daily huddles, flash problem solving ideas, regular state of play meetings, communication systems, and fun activities for employees and their families. To establish clear short term goals and methods for celebrating achievement and milestones. The goals for our progressive care unit is to build cohesiveness by ensuring relationship, by enhancing relationship between the company, staff nurses, patient care technicians, and leaders by December 2017. Goals are important. They are important because they help shape the future and direction of the unit. It assists in building commitment for the team. It provides a foundation for accountability and performance. It assists in mobilizing people and resources toward goal attainment. We also use a SWOT analysis to determine the strengths, weaknesses, opportunities, and threats that concern the unit. Some of the strength that we found for PCU is the manager. We have an excellent manager who communicates well. The need for patients and families are first priority. There's also a low patient to nurse ratio, and we have an excellent internet based design teaching guide and videos made available for patient and family. The weakness that we found was lack of cohesiveness among staffs, especially towards new nurses. The units could benefit by developing a more cohesive team. Diversity programs would be beneficial. because it is the key for productivity and cohesiveness in the workplace. Diversity workshops and programs will also aid employees in understanding the value the diverse backgrounds of their co-workers. Threats were conflict, bullying, lack of teamwork, decreased patient satisfaction rate, high employee turnover rate, low productivity, and negative employee morale. A strategy map was also used to ensure strategies were more successful. In doing so, it helped capture, communicate, and manage the strategy much better. Strategy map also capture your management team's thinking in a rich manner so it is easy to communicate. It also explains how the strategy will bring about a change. And here we have an example of a strategy map that was used. For any plan to be successful, we must build bridges and identify and engage stakeholders in along the way. Some of the stakeholders for PCU that was identified are Becky Maldonado, which is our clinical manager, Jackie Reeves, our clinician, Pam Garland, nursing director, PCU staffs, nurses and patient care technicians, Carol Daniels, our chief of nursing, patients and families, future recruits, the community, Philip Wolf, the hospital CEO. You may ask, what strategies are we proposing to build cohesion in PCU? First, we plan to socialize and get to know one another as individuals. We will plan an activity outdoor in the summer at the park or facility of the grounds to allow employees and their families to interact and get to know each other. This will be helpful in welcoming and engaging new employees. An outdoor activity will allow everyone to get to know each other and allow everyone to feel a part of the team, thus building cohesion. Second, we plan to celebrate. How may we do that? We will choose an employee of the month. We will celebrate such an individual and we will let everyone know the qualities they possess that make them qualified for that. Also, we will celebrate birthdays throughout the month by providing refreshments for all employees to take part in. This allows employees to feel special and a part of a team. Eating together creates a sense of togetherness, furthers employees' appreciation for each other and their environment, thus building cohesiveness. Thirdly, we plan to have an annual party, and preference would be a Christmas party for employees and their spouse, so that they can interact with each other. Also, this is a great time to celebrate accomplishments throughout the year and do door prizes. This strategy will further build cohesion, and employees who are awarded will most likely work harder the following year. And others will try their very best to work as hard to be recognized the following year. This is also a great time to discuss goals for the upcoming year. Other areas to think about in the planning process are financial strategy, production and operation, research and development. Financial strategy. In this, we will have an in depth analysis to formulate strong conclusions, such as making the right choices and prioritizing implementation decisions. Managers must formulate where and how best to tactically focus their resources. Production and operation will deal with how and where functions to bridge cohesion will be facilitated. Areas may include parks, restaurants, grounds of hospitals, and other recreational facilities such as bowling and skating. Research and development will be carried out on ways how to build cohesion and its effectiveness. Development in areas of culturally sensitive training in the development of cohesion should be conducted on a regular basis. What are some tactics that we will use in this planning? First, we will make sure that goals are realistic and measurable. We will involve managers, charge nurses, clinicians, and director of nursing in the implementation process. We will also use simple, creative ideas and reward system. Steps that will take to enhance collaboration for a success plan will include defining a goal or objective that will be used for the team. We will select a team to ensure the objectives and define roles for the process. We will also gather resources and other needed supplies to carry out the change. We will implement the right leaders with the right leadership approach. We will give staff the opportunity to be involved in the change process and communicate changes every step of the way. And also keep stakeholders, managers, and clinicians informed every step of the way. Some leadership strategies in the implementation process will include effective communication. We will communicate plans step by step to stakeholders, gather feedback on process, frequent monitoring in order to make changes as needed and reward success. Team collaboration among multiple stakeholders. We will develop a close working relationship with the stakeholders by engaging them in the plan. Involving stakeholders will add soundness to the analysis. According to the National Defense University, involving stakeholders reduces the amount of mixed guidance to the team and clarifies the reporting relationship between the team and strategic decision makers. Involving stakeholders in events, publicity, and soliciting their input based on the vision of the organization. Now the plan is set, it's now time to evaluate, and you may ask, why evaluate? The Progressive Care Unit will evaluate its social cohesion efforts to make certain resources are allocated professionally and efficiently and make adjustment as necessary. Evaluation evaluation is important because it guides you through each step of the process of evaluation. It helps you decide what sort of information you and your stakeholders really need. It keeps you from wasting time gathering information that isn't needed. It also helps you identify the best possible methods and the strategies for getting the needed information. It helps you come up with a reasonable and realistic timeline for evaluation. Most importantly, it will help you improve your initiative. Steps that we will take to make sure this plan is a success. First, we will seek to develop an evaluation framework. We will work with PCU staff to identify how to measure the appropriateness, effectiveness, and efficiency of actions in place. Then we will gather evaluation data. We will consider what data will be appropriate to support the evaluation objectives. We will review the outcomes achieved. This will allow us to draw conclusions about whether and how social cohesion was improved in PCU as a result of actions put forth. Finally, we will share experiences. We will help other PCU staff learn from their experiences in terms of the process and the outcomes. To evaluate the plan, we will use metrics such as surveys collected on the unit, and this will record the attitudes concerning different cultures and experiences. We will obtain feedbacks weekly during huddle by people from culturally and diverse groups. We will have key informant interviews with the charge nurses, leaders, managers, and other staff members. We will also gather recommendations for program to build cohesive in PCU. We have now come to the end of this presentation. Now is the time and opportunity to ask questions. Thank you for your time.